people of Flint today, as we sit here, can they drink the water?
No, we don't want them to. And that's the terrible tragedy of all this.
Tonight, as the people of Flint wait and wonder if they have been poisoned by the lead in their water, Michigan Governor Rick Snyder admits he failed them and promises to fix the crisis.
All medical experts agree no level of lead ingestion by anyone, especially children under the age of 6, is okay. So
That's correct.
You said last week over 100 children here in Flint have high levels of lead in their blood. How many kids is it as we sit here today?
It's about 100 and some if you go back over the last couple of years.
You're saying there's 100 children as of now. There may be many more.
There could be many more, and we're assuming that.
That it can mean a decline in a child's IQ forever, affect their behavior. It's linked to criminality, and it has multi-generational impacts. It can be passed on. Talk directly to the parents of Flint right now who have a child that is going to live with this.
Yeah, this is awful. And again, our goal is to do whatever possible to minimize the damage, to help support them through that. This shouldn't have happened. Again, this is where there was a failure in government in terms of people not using common sense enough to prevent this from happening and identifying it soon enough.
A local pediatrician, one of the first to discover the lead in the water here, calls the impact on the children irreversible and multi-generational.
For those parents that are sitting here today and wondering, is my kid going to not reach their potential because of this? And that's going to happen to some of these kids. We know that. Dr. Monahana Atisha told me that what can be done is that you can minimize the impact through early literature programs, universal preschool, access to healthy food, so say the calcium binds instead of the lead to the child's bones, etc., mental health services. She put a price tag on that, Governor, and she told me it's going to cost $100 million just to do that. Will you make sure they get $100 million?
I'm not sure she would know how to put the price tag. I have reviewed recommendations she's made. And actually, a number of those actions we were already working on doing in Flint.
She's done the analysis. I'm asking you again, $100 million. Will you make sure they get that if that's what they need?
Well, we're making sure they get what they need.
A 2011 study found water from the Flint River would have to be treated with an anti-corrosive agent to be safe to drink. To do that would have only cost $100 a day, but that was never done.
I was speaking with a young man this morning, and he said to me, they put money over people. And he said, the black lives and the poor white lives weren't worth it. When you look at the numbers, $100 a day, what happened?
Well, that's the failure point. I mean, in terms of cost structures, $100 a day, this is where the huge error was, is there were people that were subject matter experts in this that didn't believe that needed to be done. That was a huge mistake. That was part of the fundamental mistake of this whole situation.
Didn't need to be done. Why?
Well, again,
that money
in terms
was
of, no,
given
not on that point.
Priority here over these
Not at
people?
all. This is where the investigations will follow up, and all those, in terms of the details of all that. And we're cooperating with all those investigations because I want to find out what went on. I want the facts out there.
The kids were being poisoned by the water they were drinking here. The EPA knew about it. Your spokesman, your former spokesman, knew about it in July 2015 and sent an email about it. And you didn't declare a state of emergency until January of this year. Why did it take so long?
Actually, I learned about it in October, and I took action immediately then, offering filters, working with people on getting water, on doing water testing. Again, we needed to do more though. So as soon as I learned about it, we took dramatic action. The failure is people kept on...
Was it dramatic action? Because the mother this morning said to me, no one came to my house immediately back in October and knocked on the door.
No, that's why I said we needed to do more. And so at this point in time, all the other efforts weren't as much as I would have liked. And so the point is, now that was the point of calling the National Guard out, about making attempts to visit every home in Flint.
Why not just immediately replace all of the lead pipes?
That's a question you can ask across the country, and the challenge of that is that's not
a
short-term project.
Flint has had people poisoned.
That is not a short-term project in terms of ripping up all the infrastructure, replacing all that. That can take an extended period of time.
Your former spokesman wrote an email back in July of 2015. Here's part of it. I'm frustrated by the water issue in Flint. These folks are scared and worried about health impacts, and they are basically getting blown off by us. You have said since then that you knew about that email and that you were made aware of that. Why not act then?
The experts came back from both the Department of Environmental Quality and Health and Human Services to say they didn't see a problem with lead in the water or lead in the blood.
The folks here
And,
did.
well,
They were
again,
getting rashes.
This is
Their
in
kids were having rashes. The water
if you could
was
let me finish,
discolored.
Poppy. I mean, that makes you feel terrible. I mean, I wish you would have done something different.
As the scope of the crisis has grown, residents have rallied, demanding the governor step down.
A number of the residents that I've spoken with in Flint have said ultimately they want accountability. Governor, will you resign?
No. Again, I think it's normal. The right action is if you have a problem that happened from people that you were responsible for, you go solve it.